Okay, my name is Kaylee Dyring and I am doing the catheter pass off. So first of all, I'd go to my MAR, make sure that this patient is needing a catheter, indwelling catheter. And I would also check for any allergies with iodine or latex in specific. But then I would gather my supplies and I'd bring it into the patient's room. Knock, knock, knock. Hi, Jerry, how are you? You're doing good? That's good to hear. Okay, can I see your ID badge? And can you give me your full name and date of birth? Perfect. Are you allergic to any allergies or anything, Jerry? Are you allergic to anything or do you have any allergies? No? Not like iodine or latex or anything? No? Okay, perfect. Okay, so I'm gonna close the curtain and then I'm gonna perform hand hygiene. Okay, so Jerry, I'm gonna get some gloves on. We're gonna be doing an indwelling catheter on you. So first of all, what I'm gonna do is I'm going to just do some peri-care, okay? I have my wipes right here. It might be a little bit cold. Okay, and then I would just wipe down in a circular motion. And then I would use a different part of the wipe every time, just making sure everything's clean. I'd also make sure that this chuck is in place, which it is. And then I'm just gonna put his legs in dorsal recumbent position so that it's easier to get the catheter in. I would take off the gloves, do some more hand hygiene. Lighting looks good. I'm just gonna lift the bed up so then it's at a better position. And then I'm gonna take this down. Perfect. Okay, so I'm gonna first open this up. Right here. Okay, and then when opening this catheter thing up, I would open it up to the top first, and then to the sides. There we go. Then I would grab my gloves and move it over here. Perfect. Then I'm going to grab this hand first, stepping away from my sterile fill. Put the glove on, then grab this other glove, step away from my field. Perfect. And I'm just going to remove that. And then what I'm going to do first is I'm going to grab the top drape. And then make sure it's not touching any of his skin or any of my skin. There we go. Making sure that I don't touch any of his skin either so that it stays sterile. I'm gonna put this other drape over. There we go. Next, I am going to place these on the side just for a second, and then have an insert date and time right here. Okay. First, what I'm gonna do is I'm going to pull off, actually I'm gonna open up these little packets. There we go. Let's see if it'll go in. There we go. Okay. Now I'm going to open these swabs and hand the swabs to my helper. Perfect. Now I'm going to take this top off of the catheter, being careful that it doesn't go anywhere. I shouldn't have bent my arm down like that when discarding that piece of paper, but then I'm going to insert the tip of the catheter into this lubricating gel. And then the last thing I'm going to do is put this saline on the sides. Then when I need to put it in the balloon, when I need to put it into the catheter, that it's easy. Okay, and then I'm going to take this box and put it in between the patient's legs, making sure I don't touch anything. Okay, perfect. I'm gonna get the swabs now, and I'm going to clean the tip of the penis. 1, 2, 3. Okay, perfect. Next I'm going to do is my non-dominant hand is going to be not sterile now. I'm going to grab the penis and insert the Foley. Insert the catheter. Perfect. Okay, take big deep breath for me. There we go. Exhale. Perfect. I can see urine, so then I'm going to stick it in about 2 or 3 inches more. And then I'm going to hold it with my non-dominant hand and then insert my Foley catheter. Kit says that I need to insert 5. So I'm going to insert 5 milliliters. Perfect. And then I'm just going to pull back just a little bit. And there is retention, so then I'm going to squirt it everywhere. Okay, usually you don't want to drench your patient, but sometimes it happens. That's why you have these. So then I'm going to put that back into, actually I'm going to just throw this away. And then I'm pretty much done being sterile. So I'm gonna throw my gloves away and then clean everything up and make sure he's not wet. I'm actually gonna droop this down too on the side of his leg. And then while drooping it down, I have this little catheter thing that I can place on the side of his leg. So what I would do is I would just put it right like this and then stick it on his leg. And then if the doctor needed a urine sample, I would be able to get a urine sample directly from the Foley, from the port. But the doctor did not order that today. And then I would rip everything off. He's not wet. Perfect. And then I would wipe him down, make sure everything's clean. There's no iodine or anything left over. Make sure you use a different part of the wipe every time. Okay. And then I would discard everything else. Are you in any pain or anything? Are you feeling okay, Jerry? Okay. Well, then I would just get him back and ready into position. I would make sure that this catheter is set right here. Perfect. I'm actually just gonna put it down right here. And then make sure that he's covered and that his bed position's all the way to the ground, and that he's comfortable in whatever position he needs to be in. And then I would go and document what I was able to do with Jerry and just hand hygiene.